Hello guys, this is Yeji Cattle Market. We are going to be talking about CBPP today. Don't forget to like this video, follow us for more videos about veterinary health. Today I find myself in Yeji and I want us to talk about CBPP, which is Contagious Bovine Pleuropneumonia. Now, CBPP is caused by mycoplasma. It is very important among cattle because it has a high level economic impact, which a lot of farmers, cattle farmers overlook. And most of the times, because they have no idea they are dealing with CBPP, which is why I always say that always consult a veterinarian, an expert when it comes to animal health issues. Now, what happens with CBPP is that the symptoms that looks like normal respiratory disease. So most farmers decide to do their self-treatment, and it complicates it because what we do not advise at vet is pumping antibiotics when there is a case of CBPP, which is why we recommend vaccination, annual vaccination for CBPP. When you consult your district veterinary office, they can assist you with vaccinations to prevent the disease. In case it happens, we must recommend action to be taken is stamping out. We identify and eliminate the particular infected animals so that they do not carry on to infect others. Because what happens when you decide to treat with antibiotics is that the antibiotics may not be able to completely wipe out the infection. So these animals will become carriers. Now when they become carriers, it will be as if that the disease is gone, but the disease still hides within the lungs. And this animal will go ahead to infect others because you would think that the animal is healthy and will be moving around other herds, and then it will be infecting other animals without you knowing. So it is very important that once you identify some of the symptoms, which is normally the symptoms it comes out with is in the acute form, the temperatures are very high. That is, the acute form is a severe form. The temperatures can go as high as 41 degrees Celsius. This is something you may not even know if you are not an expert. And also, they experience labored breathing. The animals find it very difficult to breathe. So sometimes they will assume some postures which can help them to breathe more. So when you can hear them panting and trying to breathe because they are suffering to breathe. So sometimes they may extend their forelimbs and then try to open up their chest in a way to form an arch position to be able to open their chest to accommodate more air. They will be having nasal discharges. Some of them will be having some foam coming out from their mouth. This is a very severe case. But you being a lay person, you may think it's a normal respiratory infection and be given antibiotics, which may not be helpful. So it is important that you consult a vet once you see this kind of symptoms. Now the subacute form, which is the mild form, the coughing may not be so severe, may not be so harsh, and the fever may not go high, but there will be coughing which is not so severe as the acute form. There will be loss of appetite. They will not be able to eat properly. Emaciation, which is they will go lame because they are not able to eat well. So once you begin to see some of these symptoms, it's important to quickly call on a vet to come and do a proper diagnosis and then give you the proper advice based on how the conditions, the level of the condition, in order to help the cattle population. Because when these things are not properly handled, it can cause a whole lot of serious effects, and then you realize that multiples of infections across the regions. Like I'm saying, the most dire situation with CBPP when they become carriers. A lot of these cases in Ghana, most cattle have become carriers of the bacterial, and they keep on they infect all other cattle, where all other herds, when they are moving. So it is important that if you notice any sign you do not understand, please don't do self-administration. Consult your district veterinarian, because in every district there are veterinarians. Consult your district veterinarian to assist to diagnose. Please engage in vaccination. Always be the one to push your district vet to do vaccination for you. Once vaccinations are carried out, it will reduce the tendency of the bacterium even occurring. Proper disinfection is important. Mycoplasma is a bacteria which can be handled with good disinfection and management practices. So once you employ good management practices, you do good disinfection on your farm, you are likely to reduce this by 80%. So employ good management practices, disinfectant, and get your vets to vaccinate your animals. Advise your neighboring ranch to also vaccinate their herd, so that it can in turn reduce the risk of infection. At the slaughterhouse, once the vet identify the lungs is infected, there's going to be a total contamination of the whole lung, which is going to give you a loss, and sometimes it can proceed to infect other parts of the internal organs, which will all be condemned. So please, it is important that you look at these signs so that you avoid economic loss. Thank you.